Welcome to Plenary Session 3, Building the One Health Workforce. There is a challenge even in the session's name, but you will understand it at the end of the session, when we have our discussion. I'm Todorka Kostadinova, professor at the Medical University in Varna, Bulgaria, and also a member of the board of European Health Management Association, and I will be the co-moderator of this session together with my colleague Henrique. Henrique, please.
Thank you, Dora. Good morning, everybody. My name is Henrique Barros. I'm professor of the Medical School of the University of Porto, and I'm the president-elect of ASPHER.
Thank you. In this short time for the session, we would like to bring together experts from practice, academics, researchers, business people, employers, people from NGOs, etc. It is a joint session prepared and conducted with ASPHER, the Association of Schools of Public Health, and EHMA, the European Health Management Association, an example how we work successfully together to One Health and prepare workforce for One Health. Thank you to all teams and colleagues that worked behind during the preparation of this session. The main questions that we will discuss are about the skills required by new generations, new graduates, and all people seeking work in the public health and healthcare fields in the 21st century. Skills that help them address the issues of global and planetary health using the new tools of digital revolution, new philosophies as One Health, and new ethical references. We are talking and working on health workforce skills in the year 2023, which is announced as Year of Skills from the European Commission. The plenary will open more windows, maybe more doors, for solutions, experience, answers. And that's why, for this reason, we invited a very colorful, very mixed group of experts, our esteemed experts and panelists. They are young professionals, young researchers, and experienced experts, academics, and researchers. And we rely very much on you, our audience, the delegates of the 16th Conference of European Public Health Association, because at the end we will have some questions also to you. And now I would like to tell some words about the structure of our session. In the beginning, we will invite two key speakers. They are now not in front of you. Professor Marie Cote from the University College in Dublin, and Mr. George Valiotis, the Executive Director of European Health Management Association. Then we will invite our experts panelists to reflect on both speakers and on both speeches, and to answer some questions that we would like to ask. We will ask also you, as I mentioned, at the end of the session. And now, it's my pleasure and honor to invite and give the floor to our keynote speaker, Mr. George Valiotis, the Executive Director of European Health Management Association, to give the first speech in our session. George?
Thank you very much, Dora. Thank you for having me today. I just realized I don't have a slide navigator, so I don't know how I progress my slides. So if someone's going to bring me one. Wonderful. Thank you. Okay. So for building the future of a One Health workforce, I'm going to present you today Be Well and Be Ready for a Different Future. 7% of people employed are working in the healthcare workforce. That's 4% of the population of the European Union. And that means 15 million people. That means we have 15 million people that we can support and mobilize to help us address the One Health challenge, to help us address the green revolution that's happening, the digital revolution, all of these things. Let's look at this as 15 million people that are part of our ecosystem that can help us to address what's happening. The digital and green revolutions are changing our world at a rapid rate, and health needs to keep up with that. So how do we do that? This is an example of what's happening in our world right now. This is a supermarket in England, which is all run by robots. They are, when you're ordering your groceries online, they are packing it, they are sorting it and getting it ready for delivery. So that's a supermarket. But also in health systems worldwide, I'm sure a lot of you will recognize Ishiguro, and they've built right now a robot army of carers for the elderly in Japan, right now. And not just in Japan, but happening in other places in the world. And I mean, I like this photo because I like the work of Ishiguro. And yes, that's a humanoid robot. They're not all humanoid. And it makes for a good photo, but it also represents the way that a digital revolution is happening across the health system right now. It's robots, it's artificial intelligence, it's things we're using right now, but more is coming. We also know that the impact on the planet that the health system has is significant. Our footprint of waste is very big. We know that 85% of our waste is non-recyclable waste, so there's efforts we can do there. 15% of our waste is toxic waste, so we've got some complicated ways to manage our footprint in that regard. And are things getting better? In some ways they are. In some ways we're learning about new technologies that can improve our waste management, and in other ways, as we've seen COVID, things are getting worse as well. So this is some of the background that has us needing to think about some of the challenges. And we saw these challenges and we thought, well, what can we do to really give these 15 million people some better abilities to address these challenges? And so at the European Health Management Association, we created this vision of this Be Well project, and we've partnered with a lot of organisations, some of which I'm going to present to you in a moment. Now, the vision of this project is that we upskill and reskill all healthcare workers, be them doctors, nurses, allied healthcare workers, health management. We want to upskill and reskill all of them in green and in digital. And what I'll show you today is a little bit how that intersects with One Health. So that's the vision of what we want to achieve. I want to show you that middle clog with the magnifying glass around the lifelong learning. These are important ways that we can build on the strengths of our healthcare workforce, people's social right to lifelong learning and having better conditions within the workplace. And I also want to direct you to the bottom right of the screen, the values. So patient-centeredness, collaboration, but particularly have a look at the dynamic coverage, the research, the comparative research, and intersectorality, because these are the technical ways that we want to make some changes. It's great to hear some of the discussions that we have around One Health and greening the healthcare workforce. They make for great tweets, they make for great statements, but putting them together in reality is super complex. So to do that, we brought together this consortium that's made up of education providers. You can see all their logos down the bottom of the screen. There's 29 partners in the initial consortium. We've got research organisations like Novell and the WHO Observatory on Health Systems and Policies, and I'll be speaking to some of their research in a moment. We've got the labour market actors, so we're working closely with the unions and with all of the profession bodies, pharmacists, the European Federation of Nurses, the European Specialist Nurse Organisation, who am I missing? Primary care doctors, health managers. So we've got the workforce designing this strategy with us, and we've got other NGOs like EuroHealthNet supporting us to make sure we understand the full dynamics. So we've got this great group from all across Europe, and we've got 4 processes. Our first one is looking at the skills intelligence, making sure that we have a sophisticated understanding of the state of play. Next, we're establishing a strategic plan, a blueprint around how we can actually technically get these changes really happening at local, regional and national levels. We're launching a large-scale partnership. So this is the snowballing effect. We recognise we have to start with this consortium, but everybody needs to benefit. I want all of you, as you look at this presentation, to think, wait, I need to be part of that, or you've missed something. We want to hear about those things, and I'll tell you about that in a moment. And then finally, we're running some actual programs by all those great education providers and running programs, piloting them in the real world to see what we can learn from that. And then all of those things collectively go back into that second square, the strategy, to make sure that we provide Europe with a really functional strategy that enables them to bring about these changes. Here's some examples of just some of the things that we'll be piloting. You can see Babas Bolyar University there doing empowering Office and Google Suite knowledge. I want to really point out to you that when you look at just the digital skills, we're looking at, since our world is changing so rapidly, And we know that 61% of healthcare workers have said to us that they received no digital training. So our current workforce doesn't have the even starting point of digital skills, and so we're looking at broad skills. So that's what's in that slide there. The other thing that we're doing, and this is led by the good work of the WHO Observatory, is looking at a monitor to see what's out there. Now, our monitor is live right now, and we're looking at green skills and digital skills. And you can Google the Be Well project and find the website, and on there, you will find listed all of these different courses. And you can see on the right of the screen, you can search by topic, by profession, training setting and language, and it's growing. So when you look at it, you'll see an example. If you were to look for digital skills for hybrid version in French, you'll see this electronic medical records training, and similarly you'd see one on circular strategies for sustainable healthcare. So these are things that we found in the field right now. Go and check it out. You'll find at the moment, because we've just launched it, very few, and I hope you'll think, wait, where's my course? It should be there. Great, we want to hear about it, let us know about it. And so that's our skills monitor. Some of the things that we're looking to address that's come from the literature is we know the top in demand green skills right now are things, traditional things like recycling, but also energy generation and management and sustainable procurement. These are some technical skills that can be used, really simple things. My slides just changed design, but in green competencies as well, we're looking at four key competencies, and it's everything from lots of cognitive and interpersonal and intrapersonal, but I also would have liked you to pay attention to the technological competencies as well, because when it comes to green skills, we know that technological skills will help improve the way that we're addressing green skills. The other thing that I want to really highlight is it's not just technical skills, it's not necessarily new occupations, it's also the mindset. So we still need finance skills, we still need people doing finance as we always have, but we want a green mentality to that. Same for human resources, same for leadership, same for all of those things. So that's where we come back to this concept of competencies. And then where do you see these things playing out? In the same healthcare provision that we've always had, dentistry, nursing, general practice, but these are actual examples from the field where different services are understanding the importance of taking a green or even a One Health approach to nursing and dentistry. So that's what's happening in the field right now. That's what the Be Well project is, and I hope you're left thinking, no, I need more. I want to tell you more. Great, here's your homework. We want you to check out the Be Well project website, look at that skills monitor. We want you to join the Pact for Skills, become part of this movement, and that very soon we'll be launching a consultation on the strategic plan that we're building, and we want you part of that. We want to make sure everybody joins this conversation and benefits from it. Thank you very much.
Thank you, George. It's now my pleasure and honor to present the next keynote speaker. Mary Cole is a professor, associate professor and associate dean at the School of Public Health, Physiotherapy and Sports Science here in Dublin, University College. Mary is passionate for teaching, I know it very well, and she has a special interest in curriculum development and how it shapes and helps to build the future practitioners. As a board member of ASPHER, Mary has the leading role in a very ambitious core curriculum program that obviously considers One Health as a major structural topic. And that is, I'm sure, what she will tell us about. Thank you, Mary.
Thank you, Henrique. Okay. A chodlachatha agus a chóide. Fáilte go maileach. Colleagues and friends, welcome to Dublin. My thanks to ASPHER and Emma for inviting me to address this plenary today on building the future One Health workforce. I come to this topic from the perspectives of a physician, a public health professional, an educator, and, as Henrique has mentioned, a member of ASPHER, whose mission it is to improve and protect the public health by strengthening education and training for public health professionals for both practice and research, who have had a long engagement with core competencies and competency frameworks for public health professionals, and who are now embarking on defining core curricula to support the competencies of the public health professional. Let me ask you this question. Do we fully understand the scope and remit of public health? And then, let me propose to you a concept of a new normal for public health, which is shaped by the changing landscapes of our time, many of which may be within our control, we hope, some possibly escaping our grasp. They include demographic shifts, global inequalities, political strife and unrest, war, migration, climate change, environmental degradation, food and water insecurity, and, of course, COVID-19. But let's not forget the wonderful technological advances that made the control of that possible. This is the ever-changing scope and remit of public health, and it's a challenge for those of us who purport to educate and train both ourselves, but in particular public health professionals of the future, to maintain currency with ASPHER's remit. It prompts us to ask, how fit for purpose are our programs? And it calls for the attention to updated curricula to reflect new knowledge and skills acquired and which will be required of public health professionals of the future. The ASPHER core curriculum has been designed to draw on work that's previously been done through ASPHER and other competency frameworks, and incorporating ongoing work by ASPHER task forces to include the COVID-19 task force, now continuing as a public health emergency task force on war, climate and health, digital health and big data, diversity and intersectionality, and professionalization of the public health workforce. We undertook to ascertain program content and delivery in member schools through a member-informed survey and using a bottoms-up approach for members to inform us what they were doing in their programs. For the 58 respondents, which we were very pleased with, we requested additional information on the detailed content of their programs. And getting that information was very rewarding indeed. This we've collated into subject areas to give you a snapshot of areas that we might regard as not really the traditional areas of public health curricula. I really will not bore you with all of this, but just draw your attention to the One Health responses, of whom we had 14 out of that 58, or 25%. Collating the content into logical themes, we came up with the themes of human health, plant and food health, animal health, climate health, and practice. And with apologies for the density and the content of these next 3 slides, I think it is quite interesting and important to take a look at what is profiled under the thematic areas identified. So in animal health, for example, an emphasis on infectious diseases, in particular zoonotic diseases, with an emphasis also on surveillance, reducing the impact of infectious diseases, and a clear recognition of the public health problem that zoonotic diseases are. Looking at human health, the emphasis is on food, water, and the microbiome. Plant, food, and food health, looking at food-borne outbreaks, food security, and not forgetting practice on the far left. We can see an emphasis on the public health specialist as a member of the multidisciplinary team, risk assessment, and regulation. Just to mention, the areas that are coloured in yellow are those that cross a number of different thematic areas. And continuing with this selection, you can see that the cross-cutting areas cover exposures in the food chain, antimicrobial resistance, impact of biodiversity on forestry, in inland fisheries and agriculture, and sustainable and safe global resources. These areas are ones that cross virtually all of the thematic areas, and you can really appreciate the diversity of the programs that are being offered in relation to One Health. So, monitoring specialized food production. Yesterday we had a plenary on the commercial determinants of health. Natural environmental hygiene. Trust and mistrust, communication. Anthropology, biodiversity, pandemic preparedness, ecology, public health ethics in One Health, food systems, sustainable development goals, city planning, demography, chemical and physical threats, and so on. These are given in no particular order, certainly not necessarily in order of importance. The next question of interest is, to what extent are participants and other member schools and programs interested in including this content in programs? And to summarize here, you can see that of those thematic areas in each of which there are over 30 topics, that those who responded, and they were not just those who had provided the initial information, they agreed wholeheartedly with the inclusion of virtually all of the topics listed in these concept maps. A further question is, at what levels should One Health content be delivered? Perhaps because the individuals who responded were primarily from academic institutions, there was a preponderance of yes to bachelor programs, master level and doctoral programs, somewhat less to certificate programs, professional training programs, and continuing professional development. But perhaps we should also ask the question, what about education in One Health at an earlier stage, even in elementary school, secondary, or high school? What is clear from all of this is the interdisciplinarity of One Health and the additional knowledge and skills that are required to work across disciplinary boundaries. And these include, you see in the centre, communication, infodemiology, a knowledge of occupational settings and industrial settings, advocacy and health literacy, climate change, diversity, leadership, pandemic preparedness, infectious and chronic disease epidemiology, political determinants of health, and public health ethics and law. So the motivation for this exercise from ASPHER is to collate and update existing evidence and to present it for guidance and to orientate all of us to the new normal in public health. We applaud the developments that have taken place in some schools, some of it, of course, contextually based. And we encourage a sharing of this learning and the potential to collaborate on content and delivery in the very near future. As a final consideration, my question is, are we focused on building a One Health workforce for the future, or on building a health workforce with a One Health approach and mindset, to borrow a word from George's presentation, and also with One Health knowledge and skills? Not everyone can be a One Health professional, but everyone can have an orientation to a One Health environment. You can follow us, and this is your homework from me. You can follow what we're doing on our website. The web address is given on the bottom left. You can contact us and give us your opinion. We'd be very delighted to hear from you. And in concluding, just to acknowledge my ASPHER colleagues, our president and past president, under whose batons this started and continues, the executive board and secretariat, our ASPHER fellow, our expert advisory groups, and of course the member schools who completed the surveys. Thank you.
Thank you, Mary. Thank you very much for this inspiring presentation.
Thank you.
Back to
Thank
you,
you, Professor Kort. And now it's time to involve our experts, our panelists, to reflect on these both speeches and also to be asked and answer some questions. And I would like to invite our panelist, Victoria Stanford, to present herself and to answer the following question. How can resident placement support the training in public health to gain the skills and experience in One Health, and how will this build the One Health workforce?
Thank you so much, Dora. Thank you for the introduction. And I just want to take the opportunity to thank ASPHER as well for inviting me to be here as just one early career professional in their network. So to clarify and to introduce my role, I'm a medical doctor specialising in public health. I have been working with the Public Health Directorate of Local Government in West of England, and I'm currently working with the UK Health Security Agency. So I think it's really important that we are having this discussion from the perspective, really, of an early career professional, someone who's in the first few phases of a career in public health. And I think this is really important because when I look around the room, I can see we're actually quite a young audience, if I can say that. And actually, I think that brings with it a huge amount of enthusiasm and motivation for this discussion. But what I think is really crucial is that we actually know that younger age groups and younger professionals are really struggling with quite high rates of climate anxiety related to the climate and ecological crisis. So when we talk about One Health and the approach that we all need in building the workforce, this is not just a nice to do or an add-on if it's something that we're interested in. This is actually something that's going to define our careers. So I just want to touch on two main points in response to your question. And this, I'm really keen to say this isn't just my voice. I'm only one, again, among many. So I've been having conversations around what One Health in the curriculum, what that would mean and look like for residents with other residents in the West Midlands region where I work. What are the challenges? What would you like to see in order to become more competent in the One Health approach? And what comes up is exposure. So we are not overly exposed to opportunities to develop practical skills and know-how in our professional development to One Health. And there are reasons for that. So firstly, we don't really get the exposure to the experts, to the skills, to the projects, to the programs. And what can happen is when we have fantastic educational innovation, such as the ASPHER core curriculum and other brilliant examples of public health curricular innovation across the world, is that if we don't match that with providing us the technical, practical, on-the-ground experience of applying that knowledge, we risk that it becomes tokenistic or a bit tick box. We're sort of aware of the One Health approach, but we don't really have the development of skills outside of really specialist subsections. So an example of this is in the UK, we have our Faculty of Public Health curriculum. We have to demonstrate that we have shown leadership in environmental sustainability in order to actually qualify as public health specialists. A fantastic innovation and really, really to be encouraged. But speaking to my fellow residents, this is actually one of the really difficult parts of the curriculum to get signed off and to show evidence for. And that really shows that it's really difficult for us to get those practical opportunities. We also know that most residency experiences, as Mary said, won't be in One Health specifically, but every single one of us here in the room and throughout the region and indeed globally will need to be able to develop those skills in the work that they're already doing. And this brings me to my second point, and this is related to some education research that I've been doing with the Centre for Sustainable Healthcare. So they're an organisation, a brilliant organisation based in Oxford in the UK. And what we did is we looked at the experience of educators when they embed environmental sustainability into undergraduate and postgraduate education. And we found that quite a lot of hesitancy and reluctance to introduce concepts that they themselves felt were quite new. fair enough. But things like carbon literacy, so it was in the curriculum, they know that they need to be teaching their healthcare professionals about carbon literacy, the environmental impacts of healthcare commissioning, for example. But actually they felt sort of unsure how to do it, and they felt that they needed to develop that expertise themselves first before teaching it. But I would argue that what we really need is this rapid and increased upskilling of the workforce for all of us to really match the urgency that's required in line with the demands of our ecological crisis that we face. So some educators were really open to a co-learning process, which I think is really important for us here in One Health. So essentially it's coming to students, coming to your trainees with imperfect knowledge, and actually breaking down that educational hierarchy, not waiting for that expertise to build up, but actually learning together with students. And we found in many cases that this created a really quite transformational learning environment. So I'm going to finish now and just leave you with 3 solutions, just in the spirit of trying to come with actions rather than just highlight problems. So firstly, give us exposure to One Health. So when we are creating curriculum, when we're creating training programs, make sure that that is matched with specific opportunities. They don't have to be formal internships. They can just be shadowing. They can be joint seminars. Secondly, do this in a way that really makes the most of One Health as sort of gold standard, really, for cross-disciplinary and cross-sector working, which is something, as public health professionals in development, we all need to show that we can do, that we can work across different sectors. So let's use One Health as the perfect example for that. So if you're sitting here in the room and you're working in animal health, invite your public health nurses, your public health doctors to come and shadow with you. If you're working in environmental science, invite the veterinary medics along. Let's do this in a really coordinated way. And lastly, really encourage and empower your trainees to really lead the way. So if you're involved in education and training, anyone in this room, speak to your trainees. Ask, what do they know about One Health? What do they want to know? What do you know? What can you learn together? And I think that will be a really empowering and really transformative way of building our workforce. Thank you.
Thank you.
Thank you, Victoria. As Dora said in the beginning of this session, we have a really diverse panel. So now it's time to listen to Professor Patrick Wall. He's a veterinarian and a public health professor. And Patrick, if we think about the topics that the general concerns and challenge that this conference decides to put forward as central themes, I think there is a pressing question that I would like to ask you. Can a One Health approach make a contribution to the plant-based diet agenda?
Well, firstly, I'd like to welcome everybody to Ireland, and thanks for having me on the panel. We promote the plant-based diet. It's been promoted as a kind of a panacea. It'll be healthier for people and healthier for the planet. And I just want to highlight another pillar under the One Health umbrella. Like we have human health, animal health, and environmental health. And as a vet and a medical doctor, I've been spending a lot of time working on zoonosis control and AMR and whole genome sequencing and all that. But there's another pillar in there, which is plant health. And what people don't realize is that conventional crops and fruit and veg currently require a lot of agrochemicals. We can't feed the world organically. So we're using a lot of herbicides, pesticides, fungicides. And currently, it's having a huge impact on biodiversity. And we're seeing decimation of pollinators like bees, and we're seeing mutagenic effects on crustaceans. In the rivers in Ireland, we've got hermaphrodite fish. And so if you actually consider the animals can be sentinels of environmental hazards, it's another umbrella, under the umbrella of One Health. Say, for example, the canary in the mine, you all remember that one. But bees, actually, we've done a project where we put radio frequency identifiers on the back of the bees, and you'd be amazed how far a bee will travel with the wind behind it on a good day. They can go up as far as 5 kilometers. And then the honey, you can analyze the honey, and the chemicals in the honey will give you an idea of the environment that the bees are foraging in. So there's a huge challenge for those of you interested in non-communicable disease. Like the epidemiology associated with low-level exposure to chemicals over a prolonged period of time is very challenging. And basically, the regulations for licensing herbicides, fungicides, and pesticides, they had set maximum residual limits below which the residues have to be in any product on the market. But now the European Food Safety Authority is looking at cumulative risk exposure. So basically, the maximum residual limit is on all your different fruit and veg and crops are all below the level. But when you put them all together, the cumulative risk exposure could be health damaging. And now with all of you in this room know somebody who has had cancer. And people don't get cancer by accident. They've been exposed to some toxicant in the air they breathe, in the water they drink, in the food that they eat, that upregulates their genes. And the science of epigenetics has revolutionized the way we look at these things. So basically, the doctors and the nurses, we keep talking about them as the health professionals. But the doctors and the nurses are really the sickness professionals. So there's many professionals under the One Health umbrella that are outside of the health service. So if we're going to go for a plant-based diet, we then need to think about how can we get safer plant protection products. So nobody's talking about safer plant protection products because nobody wants chemicals in the environment, but we can't feed the world organically. So we need chemists on the job, and we need think about disease-resistant crops. And so we need botanists and plant geneticists and like CRISPR, GMOs, and there's a subset of people in the European Union that are anti-GMOs. But if we're going to use less sprays, we'll have to use all the technology. So finally, under the One Health umbrella, we hear a lot about risk analysis, risk management, and risk communication. But we need to think more than risk communication. We need risk and benefit communication. So if we're going to avail of modern technologies like CRISPR and GMOs, we need to actually have One Health communicators that can communicate the benefits to the public. So the point I'm leaving you with is that there's another pillar under the One Health umbrella, and that's plant health. Thank you.
Thank you. Thank you, Patrick. And I'm going on the other side of the scene now, using as the TV speakers the first version of the strategy of Be Well for skill strategy for digital and green upskilling and reskilling on health and care workforce. You can see it on the website of Be Well project. My next question is going to Monica Georgiana Brinzak, maybe I not pronounce this perfect, our young panelist and young expert from Romania. I would like first that you present yourself and answer the very long question, which is divided in two parts. First part is, how are researchers fitting the One Health workforce, and what is their role? And the second part is how we can increase collaboration among the workforce, especially in One Health. The floor is yours, Monica.
Thank you, Dora. Hi, hello. As you've already heard, my name is Monica Brinzak. I come from Romania, where I do research. So I'm speaking about research and teaching. And then I am coordinating UFA Next, which is the next generation network within UFA. And first, I would like to thank my professors from the Department of Public Health, and then my team from UFA Next. And also, I would like to congratulate my colleague speakers for already making the case for One Health workforce. But if you need further convincing, I will try to do so. Welcome to Dublin. I'm so happy to see so many of you here today. And now I think that we all have seen from Mary's presentation the difficult times in which we are living. Challenges, global challenges are around us. And we are so much trying to live through them. And sometimes this can be hard, and especially if you are alone. So we need to come together. And before going any further, I would like for you to raise your hand answering two questions. First one, who from here heard about One Health? That is amazing. Thank you. And now, I'd like to see how many from here have worked in interdisciplinary or multidisciplinary teams in the One Health spirit. Okay, that is quite sad that we see such a big drop. And this is why I am here, to talk about collaboration, to talk about the challenges that we are facing and that we cannot fight them together. And to make the case a bit even clearer, I will talk about Ebola. Who from here has heard about Ebola? Please raise your hand. Okay, that's amazing. So Now, who from here knows how Ebola was ended, basically? Okay, so I see a few hands. So basically, Ebola was causing a bunch of deaths, and no one, medical doctors, could not get to the end of it, could not discover what was causing it and how to stop it. And they worked on that, and they've tried to use their medical knowledge on humans, and they could not get to the end of it. And until they came together, so here I'm speaking about medical doctors, veterinaries, environmental specialists, public health experts, or as I am, and then researchers. And they came together, they've done research, and they've worked, they've discovered that this is a zoonotic disease, and in this way a vaccine was created, and one of the largest and most complex outbreaks in the world has been ended. And now, I'd like to make the case for a collaboration. Research and collaboration, and workforce in general and collaboration. Because I've already mentioned that we're living in this world where challenges are around us. And unfortunately, it appears that we cannot escape these challenges. We just have to make our way through them. And I feel that us, as a young generation, and I see, as Victoria said, that it's quite a few of us here in this room, and I'm speaking from the position of a young advocate, that we have to put some work in, because it's our future, and if we do not work for it, I'm quite afraid that we won't have a future. So we really need to put some work in. And unfortunately, it's not sufficient to work only within our field. That field are being public health, medical health in general, veterinary, environment, or anything like that. Because I said this yesterday, and I want to say it again until it's very clear. We cannot treat health as a one singular, independent field. Health is part of all aspects of our health, of our life, and of our environment, and we have to treat it as such. We cannot treat health as one independent field. That is not sufficient. We have to collaborate with our colleagues from veterinaries, as Victoria was saying, to shadow, to see how we are affecting the health of our animals and how the life of our animals is affecting us, to see what we are eating. Yesterday, Patrick was saying beautifully that, okay, our plants, the food that we eat, maybe has no risks, but together, what is the risk, or what is the cumulative risk of the food that we are eating? We have to think of that, and we will have to work together. And also, what I want to add before leaving you is that it is not sufficient to work between fields, but it's necessary. And for this, I am urging the young generation, and I'm kindly inviting the more experienced professionals that we have in this room to work together. We, as the young generation, we have to use our power, we have to use our energy to create new things and to bring everyone together. And we have to do that not starting from the zero, because that would be work that cannot be done in one lifetime, but we have to build on the knowledge and on the expertise that has been gathered until now. And for that, I kindly invite the more experienced generation to guide us, to support us, and to help us make the best decisions that we can on the knowledge and on the skills that we have. We have to come together, and we have to work together for a better future, better health, and for us. Thank you.
Thank you, Monica.
Thank you. So I think it's time now to listen to Lucy Nugent. She, as you can see here, she's the president of the European Association of Hospital Managers, and thanks for making possible this session also. And she is the chief executive of Tallaght University Hospital. So you are in a great position to know that to run a hospital is quite complex, and you have to make very difficult decisions. So can you help us as public health practitioners or scholars to convince a CEO to support an idea, a project, maybe something related to a One Health approach in these days?
Thank you for the invitation, Henrique. Welcome to Dublin. I'm also a Dubliner, and my presidency of the European Association of Hospital Managers started 18 months ago. And one of my primary objectives is actually to work with our 28 associations across Europe to have the environmental impact of what we do every day on the agenda and taking action to reduce it. We all know in the room that if healthcare was a country, it's the 5th largest contributor to greenhouse emissions. But when I'm here, I'm absolutely passionate about One Health. And then I go back to my desk, and there are multiple competing priorities. So I suppose how am I convinced, and how do I convince others? And I always think if you start with the why, you will get people to engage. And in healthcare, we're very lucky because people who come into healthcare tend to have a caring mindset. And the first do no harm applies to patients, but it actually applies to the environment and the world we live in every single day. So telling a story has an impact. You'll get me to engage. So I'm very lucky that I work with some very talented people. And 2 of our newly appointed consultants got together, ganged up against me, and asked for an hour of my time. This is several years ago. And I said, okay. And they did this presentation that blew me away. And when I thought about the environmental impact, I thought about things like the building, our energy consumption. But they actually said, no, we're here to switch. And I said, switch. And what they were saying was, for example, a metered inhaler. The CO2 emission is the equivalent of driving from this convention centre to Galway, which is on the west coast of Ireland, and 220 kilometres away. However, if you switch over to an alternative inhaler, it's only 6 kilometres. So straight away, why aren't we doing it? And it's because we have a mindset of, while there's change in healthcare every single day, we have a mindset of, yeah, that drug works for my patient, and I'm not going to unsettle things. Whereas they said, if we engage with the patient and explain to the patient the impact of their inhaler, give them the choice to change. And I went, well, why not? Simply speaking, if you shift from doing a gas induction to put someone to sleep to an intravenous, again, you are cutting your carbon emissions by 1,000-fold. So it's not just about the world we live in, it's how we actually work and live. Simply speaking, as George said, only 15% of healthcare waste is hazardous. So what is the other 85% and how are we managing it? I was at a conference recently, a colleague from Geneva said they focused on their menu for patients. I said, well, just heavily meat-based menu. So they sat down with the chef and explained to him the reason why they wanted to try and introduce a more vegetarian-based menu, because of the actual impact of meat production, transportation, etc. And they did simple things as well, like putting the vegetarian option to the top of the menu. So again, I learned from that story. I came back and I said it to my chef. And again, they were like, why? And again, we had the conversation of it's not just putting a plate of food in front of somebody, it's the whole journey and process to which we get there. I have to agree with Monica, the younger generations, they stimulate and challenge me positively every single day. There's no, we have water fountains now. We all have our chili bottles because previously we were all walking around with the plastic bottles. So raising that awareness is really, really important. And it's something that you have to do every day. And it's focusing on the right things. And as a CEO, I appreciate that I am in a position of influence. But that doesn't mean to say that it doesn't come from the bottom up, the top down, and across. And that's really, really important. and how we scale and expand. Sometimes, the old adage of how do you eat an elephant one bite at a time. We've started small. We've built on that success. And interestingly, we were doing it because it's the right thing to do. It's the right thing to do now. However, what I didn't expect was the staff satisfaction and the patient satisfaction when we started to promote some of the things we did. A simple thing, we changed all our light bulbs in the hospital to LED light fittings. That resulted in a 20% reduction in our electrical consumption. It's a great story. And actually, it wasn't a big inconvenience. It was an upfront cost, but if you take a longer-term view, and that's one of the challenges in my role, is to take that longer-term view. So the decisions I'm making today, what impact will they have tomorrow, 10, 20, 30 years for my great-grandchildren, hopefully. So what I would say as well is again, to collaborate, to learn from others. We are lifelong learners in healthcare, I think. Change is always guaranteed in healthcare. It's how we embrace it and appeal to the hearts and minds of people. And my last word is steal shamelessly. If someone has done it and it's a good idea, steal shamelessly. Thank you.
Thank you very much, Lucy. And now it's my pleasure to invite our next speaker, panelists, and experts, Milka Sokolovic, the Director General of European Public Health Alliance, to present herself and also to answer the next question. What is missing? What is the gap? And where is the gap? And what we need to do now for One Health. Thank you.
Thank you, Todorka. I will skip presenting myself. You have internet for that. What I would like to do here is to zoom us out for a second and then zoom us back in. And for zooming us out, I would like to use this beautiful building that we are sitting in, glass, round, actually a perfect metaphor for us speaking within our bubble, right? We have touched on the complexity of One Health, but Professor Wall has brought us a little bit out of healthcare into the zoonoses, the vet world, the environment around us, but there is more to One Health. Yeah. And that is what I would like to stress here, that the complexity of One Health is perplexing. And the health of people, animals, and the planet is so interconnected that not a single aspect of it can possibly be addressed on its own. And that, I think, is what's missing in this discussion that we are having here. So we say, and we need to be critical of ourselves, we say we have a colorful panel here. How colorful are we? Where are the environmental scientists or advocates for climate change? Where are farmers? Where are, there is so much more to what we would like to think of as of One Health workforce than the public health workforce that is educated for One Health. So I would dare to say that there is no such thing as One Health workforce. So that's a challenge for us. I would say sometimes public health workforce is difficult to define, right? But One Health workforce is impossible to define. It doesn't exist. And what we need to keeping in mind is that to tackle complexity, we need complex solutions. And for that, we need coordinated, international, multi-stakeholder, interdisciplinary approach to everything, from research over education, to prevention, to investment, to policy. So that's zooming us out. Let's zoom us in. And I would like to take the AMR as the example. We are aware of it, right? Antimicrobial resistance, I won't ask for raise of hands. I know that we know, right? And we also already know that it puts an unprecedented pressure on health and care services in Europe. In Europe, at the moment, yearly, it is a cause of 35,000 deaths. Let's put it in a bit different perspective. the antimicrobial resistance is a cause of 1.2 million deaths globally. That was 2019. If we don't act effectively on it, we are expected to face up to 10 million deaths globally by 2050. And actually, a little bit more conservative estimates or a little bit more recent research suggests that that will happen by 2040. Again, putting things into perspective, COVID has killed 6 million people, and now we are talking about 10 million people annually. COVID has shown us the impact of not having a cure. And then the mpox has reminded us again that disease knows no border. So my question for all of us here is, why aren't we in panic?
Because we are human.
Okay. So for me, what's missing is that sense of urgency. So I kind of identified interdisciplinarity, which we need to understand on a whole different level. But the sense of urgency we also need to understand on a whole different level. The research is key, fully agree. But Professor Pettigrew yesterday made a valid point that we know enough to act already. Yeah. We don't need perfect evidence. We need good enough evidence to act. And then research can be done further for us to adjust our action. Other point, education, critical. But education takes time. By the time we have developed our curricula, by the time we have introduced it, implemented, and trained the first batch of professionals, and I'm talking not only about healthcare professionals, I'm talking about what we would like to know as One Health professionals. We are 20 years down the road. What happens in these 20 years before then? What do we need to do? So I think we need to act with a sense of way bigger urgency than what we do now. And as Victoria was proposing solutions, I would like to propose some to start us off, very much in line with what Victoria was saying. So building skills and knowledge and capacity is the way forward in this kind of intermittent period. Upskilling and reskilling is okay, but I think we also need upscaling and an opening to other areas or sectors and professionals. We need capacity building for vets, for farmers, but also for social workers, for educators, for children, for media, for policymakers. So that would be one way forward before we have entered One Health into curricula across the board. The other way forward is a massive awareness-raising campaigns. Mm-hmm. Given the scale of the problem, I think the public health messaging should be of the intensity of that we have had during the times of COVID. And the third thing is advocating for One Health approach to health and public health. And I would just like to remind you that in Rome at the World Public Health Conference, ASPHER and EHMA have come up with a manifesto that actually calls for all of us to advocate for better recognition of public health and to advocate for better health for people and the planet across disciplines and sectors. And I would like you to invite you to check for that manifesto either on EHMA website or on ASPHER website and to commit to it. That's our duty. Because no single organization or sector can achieve this mission alone. And everyone has a stake at it, and everyone has a part to play in improving our health. And I would just like to encourage us at the end of my intervention, we must not get frozen by the complexity of One Health. Yes, it's daunting, but to quote Dr. Danilo Lofo-Wong, who leads the AMR task force, so to say, within the WHO Euro, he said, in One Health, we don't have to do everything together, but together we have to do everything. So thank you.
Thank you. Thank you, Milka. The time is flying. We are to the end. We came to the end of our session. Yes, 5 minutes are too short to talk about this huge issue, huge problem. It's not a problem. It's a new development. And now we had very good willing to ask the audience for questions. But now I will tell you the questions, and you take them as a take-home message. What we can do individually and how this might allow co-learning opportunities, how co-learning is enable new generation for One Health specialists within the public health workforce. Do you have examples? Share them with your colleagues that you met here. Find new colleagues and do it individually and also organizationally. And now it's time to close our session. I will invite my colleague Henrique to say a few words only.
Thank you, Dora. Just to finish and to a certain extent to wrap up, which is very difficult. But I think we need to say that One Health cannot be seen solely as a strategy to prevent emerging or emerging infections. It's much more than that. It is a complex approach to increase individual and community health capital. So it is a strategy for health promotion and for disease prevention. And it's even more than that. As we heard today, it's a mindset and it's a central contribution to a sustainable healthcare system. And in the end, it will be finally a way to get a better society. Thank you very much for attending this session.
Thank you. As conclusion, because yesterday we had one preparedness session with our colleagues, and I will say only one word that we discussed, responsibility, with 5 dimensions: individual, collective, organizational, political, and professional. Be healthy, go further with the conference, and go home with the take-home message, and be responsible in your life for everything together. Thank you. Thank you very much.